Welcome back to Reclaiming Vitality. I am your host, Dr. Onna Lo, an Ivy League trained integrative medicine and functional medicine doctor. And I am a high performance coach for women who are ready to reclaim their energy, confidence, and clarity. This show is all about helping high achieving women break free from burnout and step into vitality using practical, expert backed tools. If you're ever feeling frustrated by persisting bloating, a belly that won't flatten no matter how strong your workouts are, or pelvic tension that just won't let go, this episode is for you. If you are excited, join me in welcoming Dr. Karah Charette or Charette.
Charette, you got it, Charette.
A doctor of physical therapy who brings a deeply somatic and science-informed lens to pelvic health. Today, we're going to dive into the misunderstood relationship between core dysfunction, stress incontinence, and the burnout loop. Oh, I'm so excited just even thinking about these three topics. So Dr. Karah Charette is a doctor of physical therapy in Oakland with a focus on somatic pelvic health with a background in dance, yoga, and evidence-based physical therapy. Karah integrates pain science, polyvagal theory, and embodiment practices to help her clients restore nervous system regulation and sustainable pelvic core function. She's also a certified Pilates and yoga instructor with training in body-mind centering and authentic movement. And she creates an environment where your body's wisdom leads the way. So aligned with how I see my patients. So I'm really excited to welcome you. Thank you for coming to this show today. Well, let's get started. Yeah. So such a handful, but really important conversation, a handful of words around core and pelvis, which we've all heard before. So let's start by understanding the core pelvic connection. Why do so many high achieving women struggle with core flattening and bloating, even when they exercise and do all the things right?
Totally. Yeah, well, thank you for the introduction, and thank you for having me to just jump right into it and also try to keep things simple, though I know we can go into more detail. Ultimately, what I see a lot in my clinic is particularly frustration around folks who are high achieving and doing really hard workouts and saying they're doing all the right quote unquote core exercises, but then consistently complaining of either felt sense of bloating or even actual visual distension, where you can actually see the abdomen kind of, pushing or moving away from the trunk, the abdomen wall. And so typically when I see this, a big thing that I get into conversations with folks about is that, yes, I'm a PT and my lens is musculoskeletal, thinking about the muscles, the bones, and how they relate to each other. However, as I've gotten into the world of pelvic health, I've had to take into consideration other systems that absolutely interact with the muscles and are nearby. So when we think of the abdominal wall, what's right underneath that is the GI system. And when we deal with folks who are high achieving and dealing with burnout and perhaps are in a more sympathetic state in their nervous system more of the time, what we often then can see is that the GI system can get dysregulated. I'm sure in your practice you see a lot of these complaints come with also GI complaints. And what can happen is that the body is actually really wise. When there's inflammation and irritation at the GI system, the body goes, oh, let's give this space. Let's get away from this painful thing. And so even though the intentions are really good, what can happen is that the abdominal wall then starts to move away, creating actually that sense of bloating. Of course, bloating can also happen for other reasons that can be the gut microbiome, things like that. But this is a very real musculoskeletal result that I can see in relation to GI issues, which again is directly correlated to a dysregulated nervous system.
Yeah. How would clients you see or patients you see come and describe that feeling?
Yeah, I hear a couple things. And this is where I like to make really clear the difference of bloating versus distension, because I can hear one of each or both, meaning I have people who come into the clinic and they say that they feel so bloated. But when I look at their abdomen, which I know we can all perceive things differently, and also when we're dealing with pain and inflammation, we can experience seeing and feeling our body in skewed ways, I would say sometimes. And so I've had folks come in where I would not objectively say that they look bloated, but they feel really bloated. And they say that it feels like increased pressure, or that their abdominal wall, yeah, it feels like it's loose or moving away. I've also had people not necessarily say they feel the pressure, but they literally look in the mirror, and I look too, and their abdomen is just kind of jutting out in the lower part. Almost like, you'll hear the people say, I have a food belly, or I look like 3 months pregnant. And then you've got people who complain about both. And that can also come with a whole host of symptoms as well, which, you kind of briefly mentioned in the intro of often these complaints can also come with pelvic floor complaints of pain, urinary incontinence, constipation. Those definitely come hand in hand. And even potentially some tightness at the chest wall or difficulty with deep breathing. So those are typical complaints that I'll see.
Yeah, I really appreciate. Well, I'll often remind patients that there are nerves that sits on our visceral organs, right? Like that is inside that actually feels different. So we have, and our body feels differently when those nerves are activated, instead of what we're used to in the external, right? In the skin, in the outer body. So those are also very subjective sensations that are real. So it's important to recognize that. So you mentioned nervous system dysregulation, such an important topic. How is that related to pelvic floor tension?
Yeah. So in general, when we think of nervous system dysregulation, and again, probably to keep it simple, we can think of the nervous system as fight, flight, rest, and digest. We also now know there's freeze state, and there can be hybrid states. And I want to say that, none of those states are inherently bad. It's just that in our culture, we can get stuck in one state a little bit more than we need to be in that state, and we have trouble getting out of it, right? And so what can happen is with nervous system dysregulation, maybe getting more stuck in that fight, flight, which can create a cascade of cortisol and inflammation and all kinds of things where the body is really revving up to go in a more protection mode. What we've also been seeing in the research is that with that increased inflammation, we also can get increased holding patterns, particularly at the fascia, which could be probably a whole other podcast episode. But fascia, which is connective tissue that wraps around everything in our body, including our muscles, can get really tight, particularly around areas where the body wants to protect the most. And so it's interesting when you bring up the organs and how we can feel those differently. The brain cares a lot about our internal organs, and particularly the organs in our pelvic bowl. Whether or not we choose to reproduce, the brain is hardwired to want to protect the reproductive organs. And so I bring this up because when we are in states of high stress, whether or not we're consciously saying, oh, I need to, engage my pelvic floor, what research is showing is that the pelvic floor tends to be one of the first and most intense areas for the body to respond with tightness and holding patterns with what we presume is an intention of protection. And so again, it can be well intended, but if we stay in that state chronically, what I typically find in my practice with pelvic floor dysfunction is that a majority of people actually have too tight of a pelvic floor. It's not usually the other way around. Now, tight muscles are weak muscles. So for people who say, oh, I think I'm weak, you can still have tightness. But generally speaking, the body orients into this protection mode, and the pelvic floor is a very neurologically rich place where the body wants to protect.
Yeah, I can't stress enough how important the concept that tension is weakness, that it can be a dysfunction. And often when I teach the Kegel, right, or often when I talk to patients, and we should jump into and talk a little bit about incontinence, stress incontinence, right, is when we actually cough and we stress it and with the muscle, and it actually, and we have often, especially women who've had childbirth, you would have a little bit of a leakage, from, urine. And it's often, they're like, well, but I'm doing my Kegel, I'm practicing tightening, but it's actually that, after a while, I realized it's really about how much we don't know how to relax that muscle. And it's adding to my really high performing, high achieving, stressed out women. They tend to actually, already hold their pelvis pretty tight, holding them from, going to pee throughout the day, holding them when they're actually feeling like uncomfortable, or just sitting all the time and being stiff. And so that concept is, I think my patients can't hear enough to, and even for myself, it's such a good reminder to just check in and say, oh, okay, what does a fully relaxed pelvis feels like? So thanks for reiterating that. Yeah.
Yes.
You and I had a really cool conversation that really led through this phrase called abdominal phrenic dyssynergia, which was actually mentioned to me when I interviewed Dr. Dan Wool a few episodes ago about bloating from the GI perspective. And that's a very common reason why women actually have bloating was this dyssynergia. So can you actually break it down for us in more of a layman's term and help us understand if we are trying to just take better care of this area and just be able to also see how it's related to the big picture, the whole body. What does this mean and what can we do?
Yeah. So that concept of abdominal phrenic dyssynergia, fancy mouthful of words, my understanding and how I want to try to break it down in the way that I see it clinically is that absolutely, again, kind of how I mentioned before, and even with the doctor you talked to about the GI components, there can be very real GI things that are going on that are inflammatory. Sometimes there can be other things that create this that aren't from the GI. But what we see is that to keep it really simple, the abdominal wall and the respiratory diaphragm with this dyssynergia, they can start to develop a paradoxical relationship. And what I mean by that is that ideally, in a quote unquote normal, healthy person, the respiratory diaphragm should actually be moving. It should be our primary muscle, which I could spend 10 minutes going into how we breathe into that. But that should be our primary muscle that we're breathing into for all kinds of reasons. One being that it actually does help mobilize the GI system, helps get the fluids moving, blood flow, and just the mechanical pressure we need to pump things through the GI system. And then with that movement, we also, especially when it comes to digestion post meals, because that's when I hear a lot of the bloating come up for folks and when this paradoxical relation shows up, is that we will also, what we want is the abdominal walls to actually maintain some tone. It doesn't mean grip or suck in, but we do need some tone for, again, back pressure for the mechanics of the GI system. What we find is that if there's some kind of inflammation or issue where now the abdominal wall wants to move away, it's less likely, it starts to learn a new relationship where it's less likely to create that tone and that back pressure when we want it to, particularly after meals. And then what happens is as the abdominal wall starts to relax, we find that the respiratory diaphragm, which we want to be the supple moving muscle, actually starts to stiffen. So they kind of, again, develop this paradoxical oppositional relationship. And so when I have folks come in, again, their primary complaint being bloating, particularly after meals, I will often assess with some hands-on work the fascia of the respiratory diaphragm. And typically it's very tight, very held. A lot of times these folks don't know how to breathe into the respiratory diaphragm, which is different than belly breathing. And it's not chest breathing either. And then I also find that they're having a difficult time being able to coordinate deep abdominal muscles, such as the transverse abdominis. And so, again, the issue is diaphragm is too tight, abdominal wall is too relaxed, particularly after eating. Because I don't want to kind of send the message that, like, oh, your abdomen should be tight all the time. That's not necessarily what I'm trying to say. But when we need it to have that tone, it's not able to get it. And then typically how I treat it is fascial work at the respiratory diaphragm, proper diaphragmatic breathing mechanics, and then proper activation of the transverse abdominis, specifically after meals or when the bloating symptoms are occurring.
Yeah. Is there, because you mentioned that it's slightly different from an abdominal breathing and a chest breathing.
Yes.
Do you mind actually? I feel like it's such an important like groundwork just for someone to know how to even just begin accessing some of that. Like I just love the way you move your hand and showing that the right, the diaphragm moving, because that's where our vagus nerve actually hangs out. And right, when we take these deep breaths, I have people visualize we're actually turning on, when we stretch it, we're turning on the sympathetic and parasympathetic nervous system to rebalance it. So this, like, just visually seeing it is actually this rebalancing act. So could you actually walk us through what is a very basic way to kind of just start dropping into that more more kind of healthy breathing pattern?
Totally. Yeah, I would say to make it, more simple and accessible in this moment would be for anyone who's listening to find a comfortable seat or lay on their back, however they're able to just relax into their body a little bit more. And maybe take a moment, and you and I could even close our eyes could stay open, but however you normally breathe, taking a moment to just notice what that normal pattern is. And I'm not here to tell people that what you're doing is wrong or that you're hurting yourself. It's just about having options, having new options. And so again, I teach yoga and Pilates, and I love these forms of movement, but typically what's taught is belly breathing. What I'm going to encourage in this moment is that if people are able to bring one or both hands potentially to the sides of their rib cage, so the rib cage in general, but I really like to start at the sides. And again, noticing if you're striving or working really hard, we're just going to invite in some gentleness. But on your next inhale, can you gently breathe more into your hands and into the sides of your rib cage? And as you exhale, it's just a long passive exhale, which also helps to regulate the parasympathetic nervous system. And if this is hard for some people, again, there can be genuine fascial holding patterns. This is like learning any new exercise. It's new for the body. It can take practice. As you breathe into the sides of your rib cage, you're actually creating space for the diaphragm to expand because it's underneath the rib cage. And we want, as you inhale, for it to expand and gently go down. And when you exhale, it recoils like a rubber band that's been stretched and then comes back on its own. And as you do this breath, ideally the belly can just ride the wave. So I'm not telling you to push your belly out, but I'm also not going to ask you to suck in. So if you're someone who's like working really hard to push the rib cage out and the belly draws in, that's a little bit too much work. We still want the belly, for this gentle resting breath, to gently ride the wave. There can be a little bit of expansion. And I would say that's a really nice way to start. Of course, there's always more to the story and to each individual, but that is typically how I get people started with diaphragmatic breathing.
Yeah, it's great.
Yeah.
Can I ask a little bit of a nuance question? So as you're actually opening
Sure.
up the rib cage expanding, often it might actually see people like not like push their belly back in versus like what is supposed to
Yeah.
happen with your lower abdomen when you're actually slowly expanding the ribs outward?
Totally. So I'm glad you bring this up because in general, for this breath that I'm teaching, which is supposed to be a restful, not a core activating breath, we're really just staying in suppleness. Ideally, when you inhale, the diaphragm is a 360-degree structure. And so I start by cueing the sides, but really we do want expansion in all directions, the front, the back, the sides. And then with the lower abdomen, the idea is that the air and the expansion, because really the core is not just the diaphragm, it's actually a 3D structure all the way down to the pelvic floor. You can think of like an inner physio ball in your trunk. We want that whole system to gently expand. And so the reality is when people are able to go there, that lower belly should also be expanding. But it's very different than belly breathing in that, again, what I see people do with belly breathing is that they're forcing the breath, they're pushing the belly out. And it's really only in one direction. That's still not 360 if all we're focusing on is the belly towards the ceiling, right? Or toward the front of the room. So long story short, the abdomen should still be expanding, but it shouldn't be with strain and it shouldn't be in one direction.
I love that. I love that clarity. What I keep hearing is just
Mm-hmm.
there's an easefulness to it, which is
Yeah,
the point is that, right, when we're in tension, the fascia grabs on and tightens. And so we're really also just somatically educating our body to get back into that easeful place. Yeah, no,
exactly.
thank you for like, I think this, it's so helpful to really just hear it. Even for me, I teach it, just hearing it in
Mm-hmm.
different ways is helpful. Um,
Yeah.
let's talk a little bit about the pelvic health some more. Um, we talked about the pelvic diaphragm and then the diaphragm, right? Clearly, those are important bowls. Let's talk about the plexus, the nervous system, right? Or the nerves that is in the solar area, which is the pelvic area, or the sacral plexus, which is in the pelvic area. How does that play a role? Like what happens when you see patients who are burned out, exhausted, or stressed out, or just have nervous system overwhelm?
Totally. one thing I think is cool as we get into this concept of like the sacral plexus, and what comes to mind for me is the bidirectionality of the body that I feel in this culture. We talk so much about stress, and often the perspective can be thinking about managing it from top down. So if I'm stressed, I need to change my thoughts. I need to change, how I think about things, whatever it might be, more cognitive or cerebral based ways, which is very valid. And also how our thoughts can influence our physiology. However, there's also the other side of the coin, which is that our physiology can influence our thoughts, right? And how our states are in our bodies can influence the nervous system states that we're in. So what I find really fascinating about my work is, even though I don't claim to be a psychotherapist, what I think is really cool is when I work for folks who might come to me with their primary complaint being urinary incontinence, pain with sex, constipation, things like this, and we start to work with the pelvic floor, because there's this network of nerves, again, called the sacral plexus. It's just where a lot of nerves converge before they branch out, or before they then go up to the spinal cord and the central nervous system. It's kind of like a main highway. What I think is really interesting is that as we start to work on what we might view as more biomechanical or physical symptoms, I also have clients then start to report to me, oh, I feel less anxious. I feel less depressed. I feel, and I'm not claiming I'm going to cure these things for people, but what I notice is that there is potentially, there's possibility for more ways of being in the body and being able to hold different emotions, different nervous system states. Because my idea behind it from a more scientific perspective is, if we're actually creating less tension, less inflammation, more health and vitality and blood flow in the pelvic floor and where all these nerves are, it would make sense to me that that information that's being picked up by the nerves is going to go back to the central nervous system, into the brain. And it's going to be hopefully better, safer information of, oh, there's less information, there's less danger, I'm safer. And these are ways that we can actually help people manage things like stress from the bottom up perspective, if that makes sense.
Absolutely beautiful. Yeah. Like I call it the physiology of emotions, right? And if you, sometimes I have patients just imagine, right, what's the positive emotion that they want to feel, and have them actually kind of wear it in their posture, and even just, and that naturally shift their posture into this new way and creates new body memories. And so I absolutely believe that, as we become more intentional, bringing fluidity, as you say, bringing that ease and just that natural, bringing more natural rhythm to the way we hold our body, we are releasing old holding patterns that are associated, from other cellular memories or other times that we've, held our body. So absolutely. Is there any tools that you love to use, or somatic tools that you love to use that you find really makes a difference around the pelvic floor health, around the lower abdominal floor health? I mean, lower abdominal.
Sure. Yeah. I mean, apart from the breathing, which is so foundational and so, in my experience, very potent and very much connects to the pelvic floor, because the respiratory diaphragm and the pelvic floor are connected. I think that's a really beautiful practice. Honestly, what you just named, there's always more nuance. And what I really love is finding the ways that individuals might connect with somatics of their own experience. What images land for them, but really imagery is such an important one, and using that imagery with movement. So it might be that, for the pelvis, I take people through sometimes like pelvic tilts, where we are using imagery of like a boat on water. We're embodying more of this fluid sense. The work that I'm currently studying, I'm a student of body mind centering, which is a really beautiful somatic modality where we really utilize anatomy and physiology to dive deeper into the felt sense of our body. So for people who are really like nerdy or want to go deeper into the different systems of the body, I've walked people through feeling different blood vessels and how the blood can feel like it's moving through and pouring into the pelvic bowl in certain places. I've played with moving from the bones, moving from the ligaments. So getting curious of like how to source movement and create new images particularly hopefully of safety, maybe even pleasure and joy. So we can also create then new stories around this part of the body that often come with stories of fear or dissociation or not trusting. So yeah, imagery, the power of imagery, story, and movement, I think is what I
Yeah.
typically come back to.
Well, on also specific physiology and anatomy, right? Like I think like in functional medicine, what I really like it as a tool is that it gives new language for my patients to articulate their symptoms,
Yeah.
their experience, but also the outcome, right? Rather than just saying for the longest time, women have only the scale, the pounds, right? Your weight as the one way of
Yeah.
measuring your well-being. But now we know, right? It's really the cardiovascular state, your inflammatory markers, your right, or
Yes.
your hip and waist ratio, or right, your fluid
Yeah.
ratio, or just right, so many other ways to describe the sense of vitality and move away from the single, very dull way of actually measuring our well-being, and for you to actually describe that it's there's this physical sense that you can visualize
Yes.
and becoming more embodied in our experience,
Yes.
literally embodied for you in your case, is really powerful. Yeah.
Absolutely. Yeah.
Um, let me see. So I uh love that what we're talking about. I feel like we can keep going. What okay. What when I feel like this is just a simple work, right? Because you also a Pilates instructor and yoga instructor. When you talk to women about understanding core work, um, what does that really mean? And what would be a very good, simple way that is a good start? Like if people are like, I have a lot of patients who just hasn't been come aware, they've just been busy. They've been taking on with their work. They've been just busy. They've been taking care of children. They've been, caretaking for their families. And then now they're like, wait, I'm supposed to do this. What what does that mean when you have to start paying attention to the core, and what's the outcome you're really looking for, and what's the benefit?
Yeah. This honestly, I feel like could be another podcast episode because there's some
Well,
really nuanced perspectives I have, and I'm noticing the time, and I may
yeah.
not be able to go into like
No, we've
depth
got this
with
is like a
this.
2-minute answer.
So yeah, 2 minute answer, and then plugging potentially another conversation because with the core, I kind of foreshadowed this, but the core is really, it's not your six pack abs, it's not your obliques. Those things are nice, but it's a deeper system. It's your diaphragm, your pelvic floor, and your transverse abdominis, which makes this closed three-dimensional container in your body, in your trunk. And its primary job is to be a good shock absorber or pressure manager. And so I'm trained in this really cool and unique work called, I'm training currently in it. It's called dynamic neuromuscular stability. And that could be what we talk about another time because they go into all the nuance of how do we actually pressurize the system effectively. But what I can tell people briefly is that when we think about the core, what I can tell you I'm not a fan of is the typical, like, let's go do crunches and like a lot of the curling things. And even though, I do love Pilates, I do think we can find more balance of ways to activate our core in a more neutral spine, at least to start. If people are having a hard time, they're having symptoms, pain, and need to learn how to pressurize appropriately. The last thing I'll say is really we want to think of our core when we're loading it, when we're doing core work, like a can of soda or a can of pop. And so what we don't want to do is keep kinking and bulging and denting the can. We want to pressurize it from the inside out. And that's going to help decompress our spine, stabilize our pelvis, our hips. And so, yeah, I would say let's get more curious about neutral spine with proper pressurization as opposed to crunching to feel this quote unquote burn for six pack abs that frankly don't do a lot for stability. So I'll leave it at that.
I love it. I love it. It's not one size fit all. And let's definitely
Nope.
schedule a time for this because I think there's so much misinformation and also just expectations around it that I think a lot of women, just like Kegel exercises, end up going the other way, especially for those who have abdominal dysfunctions or my high performer who are already super stressed. As we end this episode, which I'm super grateful for you to be here, what's one advice that you would give your younger self now that you're this wiser, somatic pelvic floor expert who has this opportunity to learn all these modality to take care of the body?
Yeah. Oh, such a good question and a hard one because I feel like there's many things, but I think we kind of hit on it today. And I want to reiterate that for me, if I could go back, or what I'm so grateful to now know is to value the subjective experience just as much as objective experiences, meaning that, right, you just talked about all these objective measures of health, and though those are helpful and they guide us, for me, somatics is about really validating what's the internal experience, the internal world, which informs my nervous system, which helps me survive and sustain in this world and whatever I'm trying to do to take care of my health. So yeah, coming back to the internal, the personal, and the subjective as a very valuable and meaningful thing.
Yeah, so valuable. I love that. Well, thank you so much. I'm gonna
Thank
post,
you.
how can people find you? What's, do you have an Instagram
Sure.
or do you have a website? What would be the best to
Yeah.
find your
Yes.
find out about you?
Totally. Yeah, I would say we do have website and Instagram. The clinic I co-own is called Bodyful Physical Therapy. So it's like the word mindful, but instead it's Bodyful, BODYFUL, just one L. And you can follow us on Instagram at Bodyful Physical Therapy, and then our website is www.bodyfulphysicaltherapy.com. I know it's a mouthful. And if folks did want to get in touch, we offer free 15-minute discovery calls. And also we just have online booking available if people are like ready to schedule, they want to do something, all of that's available online. And if they follow our Instagram, we do try to do like quarterly workshops in the community. So for folks who maybe want to start with workshops, signing up for our newsletter or going on the Instagram would be a good way to stay in touch with the community offerings that we have.
Amazing. Well, thank you so much. Our time's up for today.
Thank
I'm
you.
sure we'll bring you back on again and we'll see you soon again.